tonight we have two of our member dentists with us tonight to talk to you guys. First, we have Dr. Selena Nguyen. She graduated from Temple in 2020. She is involved with the PDA and ADA. She's the new dentist committee chair for PDA. She's an ADA ambassador and the president-elect of the Chester, Delaware County Dental Society. And she was a member since ASDA her first year. She has worked in several practice modalities since, from a DSO office to a small cosmetic private practice to now a community health clinic, Project Home, which is a federally qualified health center in North Philadelphia. In her free time, she likes music festivals, attending Comic-Cons, and cuddling with her dog, Ozzy. Our other dentist with us tonight is Dr. Emma Strauss. She graduated from Temple Dental in 2023. She was the president of the Honors Advanced Restorative Society, a member of the Honors Prosthodontic Society, served on the Honor Board and the Post-Baccalaureate Admissions Committee, and was a Post-Baccalaureate and DMD ambassador. She is on our New Dentist Committee, and she works in a private practice for the last year in Lancaster, PA. In her free time, she likes to garden, bake, and pursue various artistic endeavors. All right, so we did have some pre-submitted questions. So we're going to go through these first, and then it will open up to question and answer. Feel free to type any of your questions in the chat as you think of them, or unmute once we get through these questions here. So we'll start with the first one. What is work life after starting as a new graduate?
So I went straight into working after graduating. I felt like I was pretty good on the requirements that I completed. So I went straight to working, and it was pretty stressful, actually. The first few months, it's always a transition with anything new that you start with, especially going from 2 to 3 appointments a day in the dental school to going to like a free-flowing schedule. And I started out with a DSO, and that was really rough. I was working 3 columns just by myself at that office. And at first, I was only able to see, I think, at most 8 patients. And then over the course of a year, I was able to see like 25 patients. So it is going to be stressful. You are going to have a learning curve, whether it's like a new software, with doing a procedure on your own, maybe even being on your own with no other colleagues in the office. But I assure you, like, you'll see yourself like a year after, and it's all the work that you push through into accomplishing that year. You're going to see so much growth, and it's definitely worth it.
Yeah, I agree. I think it definitely is a big transition, as with kind of anything in life as you're kind of changing. I'm not sure if it's also kind of reflecting on like work-life balance, if the question was kind of getting at that as well. I think a lot of that also is kind of what you make of it, setting aside time for yourself, and kind of being forgiving with yourself as well, and understanding, like, as you're starting out, it's going to be hard and you might make some mistakes, but you just have to kind of I don't know, just be kind of accommodating towards yourself and accepting towards yourself with that as well.
Hey, is it possible to work as well as take CE courses, especially implants courses?
Yeah, so your first, I think it's 2 years out of school, you're not required to have CE courses. But I mean, it's kind of an expectation that you take CE courses throughout your career. Also, sorry, my dog is starting to talk. Harry, stop. But I think the main benefit, especially of taking the CE courses, is getting to know the people in your area if you're taking in-person CE courses, so that in addition to, expanding your already existing knowledge, lets you kind of socialize with the other dentists in your area as well. So it's definitely possible to work and take CE courses, especially implants courses. You just have to kind of search and see what they're offered.
You can also go to either like your local dental society will usually have like a bunch of CEs that they offer, usually as like a member benefit. Same thing with the PDA. I personally love to go to SmileCon every year because they have really good hands-on workshop courses. Last year I did a, what did I do? Sorry, it was like a margin elevation workshop, which was really cool. So you definitely can fit in time. You can even make a trip out of it, such as like with SmileCon, and be able to also network during that time. A lot of other CE courses or even like study groups may take place like after work or on the weekends. So it's definitely doable to work around with the work schedule.
Okay, next one. What are some mistakes you made as a new dentist that you would advise to avoid?
Um, One of the biggest mistakes, I would say, just like a general mistake more than I can chew in the sense of case selection. Um, I think that as a new grad, of course, you're like, oh my gosh, like I just want to jump in and like do it because that's the way you learn, which is true. But there are, you do have to take it with some precaution and think about what's best for the patient in the case that there may be a complication or a risk with a procedure that you may not um, think that you can do with like 100% certainty it's going to be somewhat successful. So case selection is really important in like your years as a new dentist, being able to put your patient first, although you know, you will also want to jump in and do a new procedure yourself just to learn.
Yeah, I agree with everything Selena was saying. I don't really have much to add to that.
Okay, what would be a better option after graduation, general dentist or residency?
So I think it really depends person to person. I know that I didn't do a general practice residency, and if we were chatting ahead of time, and Selena didn't, or I should say, Dr. Wynn didn't do one either. But I think it really just kind of depends on how prepared you feel personally. So you know, whatever school you're at, does that school have a high amount of clinical requirements? Have you had kind of experience doing a little bit of everything or a lot of bit of everything? And how comfortable do you feel doing that? If you don't feel confident going out and working right away, that's fine. And you can go ahead and do a residency in that case. And if you're unsure, I think the best people to ask are going to be your clinical faculty, the people who see you and work with you every day, and just kind of go up to them and ask them, hey, with where I'm at right now, do you think that this is going to be enough to go out into general practice right away and and be successful, or do you think I would better serve or be better served doing a residency? They're gonna guide you the correct way. They don't want you going out and feeling uncomfortable either after you graduate. They're gonna want what's best for you, and they're able to kind of see how you're doing and where you should be, and if those two things kind of line up.
Okay, as a new grad, how do you handle situations when you need help or you're unsure what to do?
So when I was at my very first job, I unfortunately didn't really have a mentor at the DSO. I had colleagues that were part-time, but most of the time I was alone at that location. Um, if again, like if case selection just didn't go through and you unfortunately hit a complication, you put the patient first and have to inform them of everything that may happen, give them very thorough post-op instructions, and then you're going to refer them. Ideally, if you can personally connect them with a specialist that you know well with, that would be best because they can maybe get in and be able to have that complication addressed if something happens. If you're unsure what to do, you can always, call up a colleague or even like many like bigs in dental school that I would just call up in my first few years, just asking random questions like, hey, I know this is a dumb question, and it's never a dumb question. And you just ask for their insight. If you are in need of a mentor, PDA also has a mentor-mentee program that you can sign up for on the website. And that's pretty much like you put in like a small little application. You'll then be kind of hand matched with usually like an older mentee dentist, or just a dentist that has been out a few years before you, in the same area, or at least in the same field as you. And that has been pretty helpful for many of my colleagues that just didn't have a mentor throughout their journey.
Yeah. And adding on for like non-urgent situations, my friends and I that have stayed in contact through dental school, we have like a group me. And usually it's just for like fun stuff where we're talking to each other, but every so often when we're like, hey, you know, I have this case coming up, what would you guys do? And then we have kind of a hive mind and we all can put input, and that's also, I think, helpful as well if you don't have like a specific mentor in the office, or if you just want some extra input.
As a Canadian citizen, can I work in the USA?
Yes, I believe so. I mean, I don't see why not. Many Canadian citizens do. We had Canadian citizens in school with us. Neither of us, again, are Canadian citizens who are working in the US, so we aren't sure exactly on kind of the steps you would take to get there. But presumably, you just go through all the same, you know, US licensing procedures and boards, and then you'd have to apply for like a work visa or like an additional, like a different green card, whatever applies to your particular situation. But at the least, I would say a work visa. But yeah.
Where are you currently practicing and why did you choose there?
So I currently work at a federally qualified health center, an FQHC, which is in the public health realm. I see the underserved population of North Philadelphia. So I see those who are below poverty level, those who are under Medicaid, Medicare. I also see a good amount of the homeless population and patients who are going through medication-assisted therapy treatment as well. So those who are very much in need. I didn't start there. So I started with a DSO, of course, and then moved on to like a small boutique private practice, and then ended up in public health. I chose public health ultimately, and actually I'm really glad that I made the career shift, as scary as it was at that time, because I realized that I wanted to focus on just patient care, and I just wasn't so much of an entrepreneur myself. And I wish I had known that a little bit earlier, like paid attention to practice management class a little bit more intently. But everyone has their own dental journey. I think I really just had to go into it to really understand myself as a dentist and how I want to practice for the rest of my dental career.
And I'm working in private office. I'm working there with my dad, actually. He's also a dentist. So that's kind of why and how I am in that particular subset, I suppose. But I think it's something that works very well for me. It's almost like my own it's almost like a general practice residency for me, mostly because I have a really good mentor. I think if I was going into it and didn't know kind of what the mentorship situation would be, I would be a little bit more hesitant, just because I know from speaking with a lot of my friends who also went into private office but didn't have the same kind of mentorship. It can be a little bit more cutthroat, not, you know, in necessarily a scary way. Like, I don't want to scare people off from it. It's a very rewarding experience for me as well. But they, depending on kind of the business model, if it's a very much, you know, commission is how you're working and you're earning, that can be a little bit stressful. But again, it's kind of a, everybody kind of fits in different situations best, and kind of like Selena was saying, whatever fits best for you is what's going to work out. And it might take a little time to figure out that exact path.
Do you have any advice for upcoming new grads and looking for job opportunities?
I think there's a question in the chat too for.
I'll answer it probably.
Yeah.
I guess at the end I can answer all the questions in the chat.
Okay.
Let's see. I want to say, don't be scared to just kind of jump into it. I know I took a bit of time just kind of like trying to weigh a bunch of different job opportunities and try to find one that like I thought that I would really want. It's really hard to know until you really go get into it and to know what you want. You only, you learn the basics in dental school. You kind of shadow different offices as a dental student or with a practice management class. But it's not until you like really start to work with a practice, like with its staff, with like the patients, that you really understand what a certain position is like. So unfortunately, you just have to dive in. A little scary, but just like anything in dentistry, you just have to do it yourself and figure it out along the way.
And kind of going off of that also, the other thing, don't let just like the dollar signs completely blind you to kind of what's going on in the office also. It can be very tempting to kind of take the offer that's offering you the most amount of money, but also kind of look at what the work-life balance is going to be at that particular office, as well as kind of, I mean, it can be again hard until you do jump into it, but see if you can try and get like a feel for, are the staff happy that are working there? Is it like a positive environment that's gonna be somewhere that you actually thrive in, versus, is this just gonna be the place that I make the most amount of money? And I mean, some people maybe that's what they're looking for, but yeah, just something to consider.
How do you set yourself up to be prepared to practice while still in dental school?
I think the biggest thing in dental school that I did that helped me be ready to go straight into working was that I didn't let any clinic time go wasted. I know that's really tough because there's so many things going on in dental school, like boards and just like trying to catch up with notes or just studying for classes. But truly, just if you have a patient that doesn't show up, do something else during that clinic time, whether it's going to a different clinic to shadow, assist, go and help a fellow colleague out with their procedure, go to like a residency department and kind of see what they're up to. I think that really helps. I made sure that like if I was in school, I was like gonna stay there. That's of course tough, but I'm really glad that I did it. There were many situations where when I was alone practicing, I'd be like, oh my gosh, like I've never done this, but I definitely saw someone else do this, and I kind of know how they navigated through it. So I would say that's really helpful.
I agree. I don't really have anything to add.
Hey, how did you manage the time management along with turning up with an assistant as you started? Oh, tuning up with an assistant as you started practicing.
Having an Apple Watch or any kind of watch on yourself really helps, and you kind of want to keep an eye on the time, not so much to like make yourself faster, but more just to like at first keep like a personal record time, just kind of see like where you are starting. It's a little hard to gauge during dental school because you're like waiting for a faculty to check in and out with. So you don't really have a good sense of what your timing is like actually practicing. So when you start, um, just kind of like keep a little track, like a little login sheet of like, okay, for a two surface filling, it took me this amount of time. And then maybe check in with it, like keep track for in like a few weeks, like say like 2 weeks. Then see if you have made any improvements. That way it's a little bit easier that if you are running behind schedule, you kind of can control and see which procedures is it and what parts of the procedures you can be a little bit more efficient with. In terms of tuning it with an assistant, um, communication is key. I know when I was a new dentist, I kind of felt like bottom of the totem pole still, and all these assistants had like so much more experience than I did, and I didn't feel like I could ask for anything. I kind of just like, yeah, I've never had an assistant before. I'm just gonna take it how it is, and whatever they want to do, I'll just like work with it. But they're there to help you. They're there to make you super efficient so that everyone can get on with their workday. Be as productive as you can, be the best for the patient. So communication with an assistant, just don't be shy. Let them exactly know like what you need, what you expect from them. You can also, I learned a lot from my assistants as well.
Yeah.
So go ahead and like ask them questions. Just don't be embarrassed. Everyone is learning in dentistry all the time, all throughout.
Yeah, I definitely agree, and especially like taking advantage of the assistant's expertise in the sense that again, they've been out and they've also worked with other dentists. Well, usually, unless they're also a new assistant, but oftentimes you're not going to be paired with like a brand new assistant coming out, ideally anyway. And so sometimes, especially you're using different materials in whatever practice that you're in now versus school, and the assistants a lot of times like they're called different things, but okay, this is an RMGI, and I know that this is an RMGI, and now I know exactly this is what I want to use it for versus I don't know the name brand of that, what is this, and a lot of times the assistants will be able to help you out with that as well.
Okay, the next two kind of tie in together. How to look for a position of associate dentist in a DSO and private practice, and then job opportunities.
I guess I have experience in both.
Yeah, you have the most experience in that.
So for the DSO, I actually for both DSO and private practice, I found both job positions that I ended up with over Indeed. So I really recommend Indeed just to anyone or even any other kind of like job search engine. Um, I believe for my DSO, there was like a recruiter. So in your like fourth year dental school, you're definitely going to get a lot of recruiters coming to you, just contacting you. It may be annoying, but definitely like entertain them. Like just see what they're all about. It doesn't hurt to have a conversation with them. They don't have any expectations of you like joining. They're just there to like scout you out, and you're also scouting out to see like what you may want to go into as well. So um, both recruiter and Indeed is how I found my first two jobs. For my current job, I also found an Indeed, but luckily the dental director that was hiring, um, it just so happened to be a PDA member dentist. And I met her at a social, and she was like, "Hey, like, weren't you the one who applied to my site's position like last week?" And I was like, "Yeah, it was." And then I got the job. So sometimes it helps being a member dentist.
Okay, and then also to add to that, the ADA does have a program called ADAPT. So it's ADA practice transitions, and they will help match you with somebody looking for an associate. You can find it on the ada.org website there. And then, are you a practice owner? If so, how did you start? I don't think either of you are, but if you know anything about that?
Oh, go ahead.
Uh, I was just gonna say I'm not a practice owner. I'm kind of on that transitioning track though. I plan on buying the practice from my dad then once he's kind of on his way to retirement. But if this is more geared towards like someone wanting to open their own practice, the way that he went about it, I can say at least, he did kind of start from scratch and open it and start one chair and kind of expand from there. And he had talked to other dentists in his area that were planning on retiring, and he bought their patient Rolodexes. That being said, that was, 30 years ago. So how viable is that in the current market where everything is like most things now, I feel like our DSOs, you're seeing a lot more kind of dwindling of the individual practices, that I'm not really sure how feasible that is. But I think the more common route now is kind of, if you want it to be a private office, kind of going up to, again, private office owners who are kind of looking to retire and then buying into their practices. And that's something I think that's kind of more of an individual basis based off of what you're looking for, as well as what that particular office owner is looking for in terms of their transition as well.
Okay, the next one, do you ask for a certain amount during interviews or just accept or reject based on the offer?
I think that kind of ties into what I was saying before about, again, I mean, the paycheck is definitely important, like definitely get that. But it also ties into, is the office itself the right place for you? Are you going to have the mentorship you're looking for? Are you going to have kind of like the emotional support you're looking for? Are you going to have the patient pool you're looking for, that kind of thing? And not that you can't be picky when kind of selecting your I guess salary, so to speak, but it's not all about kind of the dollar sign that's attached to it. I mean, for example, like Dental Dreams, I think a lot of people have heard of Dental Dreams. It's kind of renowned for being a DSO that has big flashy signs of, we have this huge signing bonus if you stay on for this amount of time. But almost no one ends up making it because it's just such a like tumultuous situation to put yourself in. So that's kind of the example I guess I'd give with that.
Yeah, it seems like Claudia's second question is related to this question as well. Um, so I know in terms of contracts, so I've gone through, I guess, 3 contracts at this point.
Yeah.
I, in the beginning, I didn't really negotiate the pay. I felt like it was pretty fair. What I would do is, of course, like same thing. I would just talk to like my friends from dental school or just like other colleagues and kind of get like we would just talk about our contracts. It's kind of like exciting, with everyone's first job. So I would just talk with my friends and be like, hey, like how much are you guys like getting? Or what's fair? So that was how I determined that my first contract was pretty standard. I also had a better idea as I did more interviews with different jobs as well, what they were offering me. So that also gives you a pretty good view of how you should, I guess, value yourself as a new dentist.
Yeah.
In terms of like, have I negotiated for my yeah, actually, I did negotiate my second and third contracts because at that point I had done additional CEs in like Botox filler. I had done CEs on like bone grafts and things like that. So I felt like my value as a new dentist with a larger skill set was more valuable to a practice that could bring in more productivity to an office. So then, yeah, I would then negotiate either a higher percentage of production or collection, or if it's like a flat daily rate, then I would go based off of that as well. So those are some things that you want to determine if it was too low or fair. You also want to take into consideration like location as well. So that goes for any kind of job. Like if the saturation is high in that area, you also want to think about the type of patients or insurances that you're going to be seeing and what their reimbursement rates are like. So there's unfortunately a lot of different considerations to look at. I would recommend to when anytime going through a contract is to have a lawyer, especially a lawyer that specializes in dental contracts specifically. There are so many like little nuances and little terms in contracts that I just even in practice management class you just don't know about. So you want to do that so that you can get what you want out of your contract and also like to maybe protect yourself as you go through your journey. So any tips or resources? I believe ADA website has a lot on in terms of like going through contracts, going through like I think that you can go through and there's like resources. There's a little tab there that you can go through and to search. I know that I was a part of the same financial group that I got my malpractice insurance and my disability insurance from. They fortunately were also able to connect me with a lawyer to go through contracts with. So anything like that, you could probably find through like word of mouth or through other colleagues that have experience with it.
Also, in the springtime, PDA hosts a webinar called Associate Agreements and Contracts. It's held by Dr. Charles Incalcaterra, and he goes very in-depth about associate agreements and what you do want to see, what to look out for, what you don't want to see. We've done it the past, I'm not sure how many years, but a lot of them, and it's a very popular webinar. The students love it, and he is very, very informational. So you'll see the email come out in the springtime. So I definitely suggest joining that if you want to learn more, and he can answer questions you have as well. The last question we have for pre-submitted ones is, what CE courses did you take your first year out of dental school?
So I took again, like Selena had mentioned earlier, I became a member of my local dental society. So I'm working in Lancaster. I became a part of the Lancaster Dental Society as well. And so pretty much all of the CE courses that they've been offering, I attended. Again, to have kind of the social aspect as well, meeting the new dentists around. But one of the ones that I actually really enjoyed and found really informative was put on by one of the local oral surgery groups. And it was on photogrammetry, which is something that I don't remember ever speaking about in school at all. So it was really interesting. And I actually did my first photogrammetry case recently. I'm about to finish it and deliver and all of that. But it's like an implant technique that I found very interesting. So something that might be worth looking into is just kind of local dental societies and what they're offering, and as well as kind of local like oral surgery groups, if that's something that you're interested in. A lot of times, like the bigger groups will put together presentations and CE courses.
So the journey that I took in terms of types of CE courses, I really depended on what I felt was most important to the job that I was in. So in the beginning, at the DSO, I was doing a lot of like extractions, dentures. So I did more oral surgery, like CEs. As I then transitioned into my cosmetic private practice, I then did like crown lengthening, like margin elevation for like crowns, and like Botox and filler. I also like did like veneers and like anterior composite CEs for that as well. And also like just like general more extensive Invisalign cases as well. And then as I then moved into my public health career now, I am doing more on like trauma-informed care, substance use disorder patients, special needs, and geriatric patients. And that's just so that I can really extend my skills out to everyone and be able to address access to care in that sense. So you'll find as you go through your dental journey and as you go through the years, there'll be like little niches that you're like, okay, I want to kind of learn more about this, and I think this would be helpful to my practice. So you'll kind of navigate there away from just like the general CEs that we may need for our license.
Okay, does anyone have any additional questions? You can feel free to unmute and ask them or type them in the chat now if you have any.
I'm going to answer Claudia's first question about transitioning through 3 different dental work settings. So early in my career, it was basically a different practice each year. And the current job that I have is probably like the longest I've had, and it's only been like 2 years now. At the DSO, it actually wasn't bad. With having the conversation with my bosses, because the bosses were corporate, so it's pretty removed to have that. I just had to send in like an email and like a notice. I think the harder conversation was leaving my staff that I work so closely with, and having to like say my goodbyes. In private practice, of course, it's like a closer knit family. I my my conversation went with how I felt I wanted to direct my dental career towards. So I was just honest. I just told my boss that I wanted to have a bigger impact and significance in the community. I just wanted to be able to reach more people, especially those who really needed it and may not always have gold standard care or access to care. So luckily, like he was pretty understanding of that. I think we worked so closely that he knew that although I really loved cosmetic dentistry, it wasn't like a true passion. So as long as you're just like really upfront, honest, you talk about your intentions, and you just make sure that there's no bad vibes that you leave that previous job with. Um, it's something that's like really common in healthcare and dentistry, or just like in the normal employment world of having to leave. Not many people like stay with their first job, and the lucky ones, great. Most of us may have to find like a second, third job. So the first conversation may be a little bit difficult, but as you go into your second or third, like me, you kind of you're just honest with yourself, honest with them, and if they truly are rooting for you in your dental career, they'll understand.
Okay, is there any additional questions? All right, I will pull up the next slide. If you have any questions still, feel free to put them in the chat. These are 2 upcoming webinars I'm hosting. Career options will be on Wednesday, July 10th at 7 p.m. You can talk to our experienced dentists about practice ownership, DSO, public health, academia, and nonprofits. Learn more about what fit is right for you. And then on July 25th, we are having an Ask a Specialist webinar. You'll go off into breakout rooms with dentists from multiple specialties, such as pediatrics, oral surgery. We have a majority of them coming, and learn more about their experience in schooling and practice. So if you want to scan the QR codes to register for them now, you are more than welcome to. Put this up for a moment here. Somebody asked, would you be able to share panelist contacts if we want to reach out later on? Is that okay with you guys?
Yeah.
Definitely.
Okay. I will be sending a post-event email. I can jump to that slide now. So I will be sending a post-event email with a survey. We have some really good questions and would love your feedback. So stay tuned for that. I will include their emails in that email as well. You'll receive an Amazon gift card for completing the survey. And if you would like to leave a testimonial, let us know if you like what we've been doing. You can go to padental.org/testimonial. I see some very familiar names tonight, as I do on a lot of the webinars. So if you guys would like to do that, go ahead. And if you have any questions, my email is on the screen. Let me see if there's any additional ones in the chat. I don't believe so. So with that, if nobody has any additional questions, thank you so much, Dr. Nguyen and Dr. Strauss for coming tonight. You guys did a great job answering all the questions, and thank you everyone for being here. I hope to see you at the next webinars this summer, and everyone have a great night.
Good night.
Hi, thank you.
Thank you.